Hi everyone, my name is Ijoma. Thank you for studying with me. Let's just dive right in. How well do you know the three clusters of the personality disorders? What is a personality disorder? A personality disorder is a type of mental disorder in which one has a distorted way of functioning, behaving, and thinking. It could affect the way one relates to people and daily routines of daily life. Diagnoses usually occur from the ages of 18 and up. So, cluster A has three types of disorder: borderline personality disorder, schizotypal personality disorder, and schizoid personality disorder. So the first one is paranoid personality disorder. Cluster A has to deal with the odd and eccentric type of behavior. So the paranoid personality disorder, um, often the client is suspicious of others and their motive. They believe that others are out to harm them. They are hesitant in giving up information to anyone in fear of being used against them. Paranoid personality disorder assumes the worst can happen. They can hold on to grudges and they have no actual evidence to justify their claims or suspicion. What do you think personality disorder is? Listen in the comments section. So the next personality disorder is the schizotypal. They usually have flat emotions. They have a peculiar way of dressing, thinking, and the way they see things. They also have magical thinking in which they think that their thoughts is what's making things come to life. They are superstitious and they can be anxious in a social setting. Schizotypal. When you think of schizotypal, think of the type of person that always ramble, that's always out of the normal scope of things. Schizoid personality disorder. So this is how I remember schizoid. You see that ID? When I see ID, I think of me being by myself, me being a loner. I actually had a tutor that said schizoid personality has a lot to do with being by oneself. So when you say schizoid, think of alone. Think of you being alone. And they prefer to be alone. They avoid social setting. They lack the ability to pick up on social cues. They are not interested in people's personal or social relationship. They can often appear to be cold with limited range of emotions. So they're not interested individuals. They don't want to know what's happening. They find it's very, very hard for them to find pleasure in most activities. They have like a main focus, robotic, to and fro, to and fro. And they often have little to no sexual desires. Is that what you guys thought of? How do you remember schizoid personality disorder? Put it in the comment section. Cluster B has antisocial personality disorder, narcissistic personality disorder, borderline personality disorder, histrionic personality disorder. So cluster B has a lot to do with being dramatic, being erratic. You see the picture, right? She has this dramatic look on her face. So narcissistic personality disorder is characterized by feelings of entitlement. They feel that they are who they are and they are special to the world. They need to be admired, and at sometimes they even feel like they need to be worshipped. They have a lack of empathy and have no problems exploiting others to achieve their own personal goal. Once they are disrespected, they often react with anger and revenge. Like, how dare you get them upset? They feel a sense of superiority. They are not empathetic to the needs of others, and they often exaggerate their achievements, their success. They like to be seen as the number one. They like to be the head stopper, showstopper. Everybody has to look at me. Everybody has to gravitate towards me. So when you see that grandiose behavior, just you can link that with somebody being narcissistic. Antisocial personality disorder. Um, they lack empathy towards feelings for others. They can be irritable, aggressive, impulsive, unapologetic for their actions. They have no problem developing relationships. They have a tendency to have problems with the law. They are uh, persistent in lying, stealing, and manipulating others. They use charm to exploit and harm others. Is that your definition of antisocial personality disorder? If so, put it in the comment section. If not, what's your definition of antisocial personality disorder? I'm eager to hear what it is. So the next personality disorder is the borderline personality disorder. That is when an individual has an absent sense of self. They fear being abandoned and neglected. They're typically in an unstable, intense relationship and emotional. They can respond with an outburst of anger, violence, and impulsive behavior. They have risky and impulsive behavior such as having unprotected sex, gambling, binge eating, and so forth. They have an ongoing feeling of emptiness. They can have suicidal behavior and threat of self-inflicted injury. Histrionic personality disorder. So the picture shows a very, very seductive African American female. She's doing everything. She is seeking that attention. But somehow, uh, this personality disorder leaves them feeling worthless and useless. They rely solely on attracting attention and receiving approval from others. They are excessively emotional, dramatic, and sexually provocative in order to gain attention. They constantly change their emotions. They are very charming. They know how to use their words, but they also act inappropriately seductive, are often sensitive to criticism and rejection. They are very, very concerned with their physical appearance. Cluster C has avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder. So, avoidant personality disorder believe that they are inferior and inadequate human beings or even unattractive. These individuals are terrified of being criticized and embarrassed or rejected, and due to these fears, they avoid social interactions. Like they avoid anything dealing with people, places, or things. They restrain themselves even in relationship with their closest loved one. They want to have a relationship, but because they're too anxious to engage, they often just avoid the whole thing altogether. And they have extreme shyness. Dependent personality disorder. They lack self confidence and need to be cared for. Not only do they need help making important life decisions, but they require help making decisions on a day to day basis. Their biggest fear is abandonment, and they do whatever it takes to ensure upkeep of their relationship. They have an urgent need to immediately start a new relationship once the other one, their prior relationship, has ended. They can tolerate being in an abusive relationship due to having fear of being alone, and they are very, very, very clingy. The last cluster for cluster C, which deals with being anxious and fearful, is the obsessive compulsive personality disorder. Individuals are preoccupied with details, lists, organizations, rules, and etc. They are extreme perfectionists, and productivity that can hinder one's relationship can have a total meltdown if perfection is not achieved. They're usually cautious and controlling to a fault. They are unable to delegate on tasks, desires to be in full control of people, tasks, and situations. They are unwilling to change ideations on ethics and value. They can be rigid and stubborn and can neglect on social life, trying to maintain their perfectionism. Um, they just want things to be in order, their way, no other way. All right, guys. I hope this video was good for you guys. I know I'm a little tongue tied today, but this is how I learn. This is how I study. I have to make these videos because it's like I'm self teaching myself and I have to make it mine. If you like these videos, you want to see more of these videos, let me know in the comment section. Give me some topics. Give me some things that you guys want me to put out. In addition to that, guys, please subscribe, like this video, share, tell your friends about it, and subscribe to this channel. Look, remember one thing. It's okay to fall. The problem is not getting up. You got this. Get up. Let's reboot. Let's get ourselves together. Refocus. Get yourself where you need to be. And let's squash this exam. All right? Have a wonderful day.